Hello, ladies. Welcome to the first episode of this series that I'm going to be running over the next couple of weeks. And this is to answer your questions more in depth on postnatal exercise, nutrition, women's health, and give you a little bit more information on topics that otherwise I would push out in captions on social media, or I would send an email, or I would create very short videos on. Because sometimes what is happening with information is that it's not personalized enough to you. It's not specific enough to you. And when you're given information in short bursts, I feel like it's not a one size fits all. And it's very, very hard to give advice on something specific for one individual out to the masses. So today we're going to jump right in with the first question that I've gotten in on the question box from the last couple of weeks on women's health. So today we're looking at a postpartum question. And we are looking at, can you damage your core and back if you don't properly strengthen them back up doing the right exercise? So let's dive into this and take it one step back firstly. Postpartum, can you damage your core or back? You have to remember that whether you've had a vaginal birth or C-section birth, there is some damage done to your core and your back. Also during pregnancy, because you are carrying extra load. So we have to consider that when you're jumping back in to exercise. And what you would look at here is your pre-pregnancy training to begin with. So what were you doing before you were pregnant, when you were possibly trying to conceive? What type of exercise were you doing? If this exercise was high intensity and high impact, did you experience any pain? And where was the pain within your body? So, a common occurrence that I see pop up lately, and this is why I'm putting this out as a longer episode, is women joining up with myself 6 months, 8 months postpartum. They've maybe done another challenge, they've done another program, they've rejoined the gym, and they've never looked at the core stability or core retraining, looking at increasing the strength in your glutes, looking at recovery. And if you skip the recovery part, what can happen is down the road, when you're back exercising and maybe you've pushed too hard or you've done exercises that maybe you thought were safe postpartum very, very soon, then you're recurring the injuries longer term down the road. So you might struggle with back pain on and off. You might struggle with pelvic shots of pain, almost like lightning pain during pregnancy. You can experience sciatica, or there might be a certain hip you can lie on at nighttime and you can have a misalignment because you never worked on improving it postnatal. So you're looking as well at the changes that occurred during pregnancy. I've written down my notes today to stay on point, that I don't go off on a tangent on you all. So, changes during pregnancy to consider. Postural changes are huge. Every single female will go through postural changes, and that's because you're carrying an extra load as the weeks and weeks go on. So, something called lordosis can occur during pregnancy, and that's a weakening of the spine in at the lumbar part of the spine. Generally, the lumbar it occurs, so your lower back, and the spine essentially curves in. And what happens there is because you have the extra load on the front, essentially your baby bump, your spine curves in because the core stability isn't there to support it and keep the spinal structure strong. So when I talk about core stability, I'm not just talking about a six pack abs and feeling like you've really strong core. Going into pregnancy or postpartum, the main focus is actually for core stability is your deeper core, your transverse abdominis, if I can get these words out, your multifidus, and the paraspinal muscles running down the back of your spine. So the smaller muscles that support the vertebrae in your spine, and the glutes. Yes, growing the glutes. The glutes massively support your core, your pelvic floor muscles, and your core. So if you're doing a lot of leg days and you're not including leg or you're not including a lot of glutes, then I would really be looking at that postpartum. So the postural changes that can occur is from the back, or if you look from the side, lordosis of the lower spine. Another thing that can occur is a misalignment. So you may have your baby lying to more one side, which commonly happens in the womb. And you will be told this on your ultrasounds. Oh, the baby is favouring the left side. That could be the side that you have more pelvic pain. You're feeling sciatica pain because maybe bump is lying in on the sciatic nerve, putting more pressure around the back. You're also looking at you remaining aligned. So if you have a toddler and you're carrying them during pregnancy, you're probably carrying them on one side more than the other because you just simply can't carry them on the front. They can't sit on bump the same way. So you're looking at if you're carrying on the left side, that you even it out from time to time, that the symmetry remains in both sides. And if you're continuing strength training during pregnancy, you will find that this is a lot easier to do because you will use equipment like dumbbells to contain symmetry within the body. Another thing you're looking at, which is a huge thing postpartum, is your balance. And during pregnancy, you might not even find that your center of gravity shifts. But when you become postpartum and you return to exercise, and maybe you're trying to do as simple as a stationary lunge position, that can be proved quite difficult. And what has happened is your center of gravity adjusted so that you would not tip over during pregnancy. Like the female body is so feckin' amazing to me that we go through this for 10 months. Your body grows, it changes so much. And then after you have your baby, you simply, your tummy starts to go down and you're left with a postpartum tummy that looks essentially like maybe you still have a baby for the fourth trimester, but your body is readjusting and resettling back to its original starting place. It is just amazing. And in that sense, your balance also has to be restored. You might even find car journeys are more difficult postpartum because if your center of gravity and your balance has shifted, what you can find is you can have an inner ear problem. Now, this is going very medical about it, but if you have had an inner ear problem and with the center of gravity shift, what can happen there is you might actually feel more car sickness, more motion sickness. You can feel dizzier quicker with almost like a vertigo type feeling. So, working on restoring your center of gravity and your center of balance again comes back to the deep core retraining. And I know this is to most females what seems like the most boring part of postnatal training, but it doesn't have to be. And I'm going to share with you exactly what you can do. You're also considering the ligaments. So you may have heard that as well, ligament pain during pregnancy, especially around the pelvis region, because the ligaments, they don't loosen, but they do soften. And I think that's an important one to mention because even myself during pregnancy, I was so afraid with the words and the wording used about ligaments, that ligaments were really stretched already at rest to the point where it's very easy to tear a ligament. And yes, while they have softened, by doing regular exercise and regular training, you can keep pain reduced and you can also keep the ligaments elastic. And that's what you want because postpartum, then it means the ligaments can return to their original state a lot quicker when there is some elasticity maintained on them. And that generally comes into play around the lumbopelvic region, which you will hear me talk about a little bit more in this. So, can you damage the core and back? Yes, you definitely can. And I want to put this out as a longer episode because the core and back are the main injuries I see from women coming into the program. The lower back pain, essentially bulging discs later in life, and also the abdominal doming. Now, I'm mentioning these very briefly because this is not to scare you at all about exercise. But postpartum, you have to remain in line with the evidence and specialist training for postnatal. So if you have started doing mother and baby classes, as an example, I am never going to pinpoint trainers in these podcasts, but some of the ladies that have come to me have had significant abdominal doming postnatal. This was at 8 months postnatal. Lower back pain, sciatic pain, traveling down the leg, and this all stemmed from doing too much too soon and doing exercises that involve direct core work for the abdominals, focusing on losing weight rather than core rehabilitation for a female that also had abdominal separation. Now, when you focus on direct core work, and I mean even full planks, and you haven't done core rehabilitation of any sort, even for 2 weeks, and I stress that even for 2 weeks, it can make a difference. Then what can happen there is abdominal doming. If there's been a large separation in the abdominal muscles during pregnancy, they haven't had time to repair. Abdominal doming is essentially when the internal organs protrude out. So the tissue surrounding the organs start to push out. And what it can look like is you still look pregnant, in a sense. And you mightn't be overly aware of what it is that's protruding out, but it can also mimic a hernia. And that's the sort of things that I have seen with females on more than one occasion of women that have signed up to me. And that is scary because that should not happen. That just should not happen. Another thing is the lower back pain. And with lower back pain, it is largely more complex because there are multiple factors that you have to consider with lower back pain, not just strengthening up the glutes and the lower back, but you also need to consider the stress levels, the sleep levels, the alignment of your whole skeleton. Is it actually aligned? Are you misaligned? When you're looking at misalignment, you could be thinking, are these exercises easy for me to do on a single leg? And that's one of the easiest ways to notice it. Or a dumbbell exercise for overhead, a shoulder press. Is one significantly weaker than the other? Can you do 12 reps on your right side and then suddenly you get to the left and you can do 6? Because that will show a misalignment of some sort. The strength is not symmetrical whatsoever. You need to work more on the left side to even it out and to work out where it is stemming from. Is it from the lumbar spine? Is it from the hips? Is it something as simple as your ankle mobility is off and it is pushing one hip to be more dominant than the other? There are a lot of considerations postpartum. But again, bringing it back, if you don't focus on the core retraining and the core stability and rehabilitation that is done properly, then you can occur damage. And equally, you can occur damage even if you're not postpartum and you don't work on connecting your core and your strength when you start into strength training. When you start into higher impact exercise, you're going to notice it in some way, shape, or form as either stress on the body, you're run down, or pain is going to occur and flare. So, postnatal, what is the big focus? Postnatal, you do need to focus on mobility work, pre and post your workout. definitely pre-workout so that you're primed for movement. Now, I am not talking a lengthy mobility work here because it does not need to be lengthy to be effective. It can be as simple as 5 minutes. But what you're doing with mobility work before exercise is priming your body for the movements that you're going to do. So think your squats, think a hip flexor stretch for lower body, think a rotational exercise on the upper spine and the upper body to encourage more mobility in the thoracic spine, the middle of your back. You're thinking engagement over endurance. So if you're returning to the gym and you're thinking, I'll maybe just do a program that I used to do. I'll sign up to a strength training program and I'll cover 9 to 10 exercises in my time in the gym, and that will be essential. And yes, while that might work, what will happen is as you move higher in weights, you will notice the core stability is not there. The core stability has not been addressed. You haven't looked at re-engaging your breath work, your mind muscle connection. And that is something that's really difficult postpartum. And I don't get to talk about this enough on social media. But engaging your breath work is not something that's going to come to you in the morning, postnatal, 2 weeks postnatal, and you will feel, oh my God, yeah, I can get my pelvic floor engaged. I can get my core together as I do my exercise. For a couple of weeks, you can feel like you're doing sharp exhales as you come up out of a squat and you can't feel your core retraining. So you will see I've posted a video on my social media of manual re-engagement. And that's something that I did myself for core retraining because I simply couldn't feel it postpartum. I was put on 3 stone during my pregnancy. Postnatal, for I'd say a good 5 months, I still felt like I was as heavy as I was during pregnancy. And that's normal. The training was coming back, but it is humbling to begin again postnatal. It is a humbling experience. No matter how fit you were during your entire pregnancy, you need to start from scratch. And I really share that because postnatal for myself, I trained right up until 37 weeks post or during pregnancy. I was massive. Ladies, I will not joke. I was massive. I actually felt like I was giving birth to a calf, and so did the doctors think that. So I was in no way, shape, or form surprised when I had to have a section, but I still trained to 37 weeks. I was very, very active during my pregnancy, easily hitting 10, 12K steps a day, would walk a 5K with the dog most days, and doing all my exercises. Do you think postnatal that made any effect on me jumping right back into a back squat? Absolutely not. Like it did help me progress quickly through core rehab and pelvic floor re-engagement and increasing on strength. Of course it did. But I still had to go back to basics. I still had to go back to body weight exercises to re-engage in my breath work, to using 5 kilo dumbbells or a resistance band. I still had to do that. And that's because your body goes through a trauma, whether you had a vaginal birth or a C-section. It goes through a trauma. It needs to recover appropriately. And you can't push it to the point where you're actually hindering your recovery rather than helping it. So, the engagement over endurance is really important in the sense that you could be doing 3 to 4 exercises in the gym and just focusing on doing them very, very slowly. The manual re-engagement of the core is something that not a lot of coaches share because, of course, they don't. You don't need to pay them for that. But the re-engagement of your core, even using a towel, you will be so surprised how much that can help. and how much that can help you engage the mind muscle connection. More than pulling abdominal muscles together, it helps you re engage your nervous system with the muscle engagement. So as you inhale, the muscles around your tummy relax, and as you exhale, you draw that towel around. I'm going to briefly touch on pelvic supports and abdominal belts because they are becoming more common. You will see women use belts, abdominal belts, even for strength training exercises, power lifters. And these belts may not be appropriate postpartum because they encourage what is called a Valsalva maneuver. So they're encouraging deep abdominal pressure that you don't want to do during pregnancy or postpartum, but you can do the breath work associated with it. So what you're looking at belt wise is possibly a pregnancy support belt. Now, I had one called a baby go belt, and I did not use that during pregnancy because, quite frankly, it wouldn't fit. But I did use it postpartum, and I found it really beneficial for keeping my core engaged during exercise functional activity and keeping it essentially to pull your core together. Now, it doesn't have to be during exercise, but what you can do is you can up your way on the amount of time you use it and tolerate it. So when I started using it, I used it for 20 minutes during the day to do a very, very short breathwork session. Then I upped it that I would keep it on for 40 minutes and keep working on my breath work. Now, bear in mind, I was breastfeeding postpartum with Jackson. So it was a case of I would wear the belt during a feed. And if he was cluster feeding, it meant I could still use the belt on to manually pull together the abdominal muscles and work on my breath work as I fed him. The pelvic floor repair as well will massively come into reducing the incidence of core and back pain. And that's because your pelvic floor, imagine a sling underneath your core. When you engage your breath and you exhale, the pelvic floor will draw up to pull the core muscles in together. If you're watching this on video, you will see me do it. Pull up the sling and the muscles on the top squeeze together so that you essentially have a triangle shape. And then as you inhale and relax, that draws down and flattens. So for your pelvic floor repair, what you are looking at is the engagement of the muscle. Now, that is a lot more than your Kegel exercises of during your breath that you pull up and engage. Again, postpartum, very hard to feel. But the more you do this, the more the mind and the muscle will connect, and you will eventually feel it work. But what you want to do initially postpartum is actually focus on both contraction and relaxation. If the pelvic floor is too tight, you will also come into the region of lower back pain and also pain associated with constipation that can result in feeling lower back pain, pain around the pelvis region, and it crops up a lot for postnatal females because the pelvic floor is too tight. You've been doing all the Kegels to tighten it up, and you've been doing that during exercise, but you're unsure how to relax it. So, a very simple cue you can do to relax it is to actually straddle a kitchen chair. If you sit on facing the back of a kitchen chair and your legs across the chair and you lean into the back of that kitchen chair and take a deep breath in, and that is your pelvic floor drawn in. And then as you exhale, let your body relax and let it relax after the exhale. And I guarantee you, after the exhale, if your pelvic floor is too tight, that's when you will find it relax and come down. And that is equally as important as contractions, as pulling the pelvic floor up, as short pulse, as longer holds. They're all elements of retraining the pelvic floor. And again, you can do these through exercise. You can do these through exercises focusing on tension as you move up. I know there will be a few clients listening to this going, that's why Julianne had me doing 2 second pause, 1 second back down. That's why she had me doing 2 seconds into the movement up to the top portion and 3 second release. And that is so that you can time your breathing around the tension and increase the pelvic floor, the core connection, and decrease the effort put in on the other muscles as well. Because you want your core and your back working on every single movement that you do. That's what's going to create a very, very strong, stable trunk on your body. And that's what you need. As you progress, as you become back to more functional exercise, functional movement, you need that to support your overall body. You also want to minimize the stress on the body. So if damage occurs and if inflammation is high, it's going to be easier to injure the core and the back. So thinking low sleep, high stress environment. Jesus, I literally just summarized the first 6 weeks postpartum, especially if you're a first time mommy. Um, so what you're looking at there is minimize the stress on the body. Where you can, you are really focusing on high quality sleep. Now, I'm not on about getting 8 hours a night because Jesus, if that's possible, please tell me how you do it. But minimizing stress and maximizing sleep can be done through your nutrition, but it can also be done through optimum windows. So if your baby is napping for 35 minutes in the afternoon and you can nap for 20, do. Like a nap of that length. I hear so many women saying, I can't sleep during the day. I'm like, try it. Just try it. Because if your body remains in an inflamed state, you're training, you're moving, you're exercising, your nutrition is not matching up to the movements that you're doing every single day, the body's going to become run down. It's going to become into a stress state and it is very easy and more susceptible to injury. And especially as you rehab your core and your core stability, that's going to be the area that you're going to feel it the most. You're going to feel that lower back pain, that pelvic pain. Periods can go all over the shop postnatal. They can go even more so if your body's under stress and the core is not going to get the chance to rehabilitate the way you want it to. Minimizing the stress on the body also comes into play with visitors. And I have to stress that one because if you are a postnatal female and you feel under pressure to entertain people when they come into your house, please don't. Um, like the first thing I would suggest you say to people when they come in to visit is, there's the kettle. Please throw yourself on a cup of tea or coffee. The fridge, help yourself to milk, direct them where things are. If you're sitting, if you're feeding, if you are literally getting your first time to sit down that day, let people do the things in your house. You don't have to be an entertainer. You are also well entitled to lock your doors and say no to visitors for a day. And I do stress that because you are also minimizing stress on your body by just minimizing your interactions. You're reserving energy in a sense. Social interactions do take a lot out of you. Add in that you're sleep deprived, add in that maybe you've had a sleepless night, baby wants to be fed a little bit more, you're going through a growth spurt or a sleep progression. You need to reserve your energy to minimize stress on your body. So, when we look at the question that I was asked, can you damage your core or back? Yes, of course you can. All these things impact where your training and where your progression will come from. Does it mean no strength training? Of course not. Strength training is going to be your foundation level. You're going to build back up strength. But when people think of strength training postpartum, they think of going back into a gym, using dumbbells and using a barbell. That could be at least 8 weeks out from when you start retraining, or it could be 4 weeks out from your start date of retraining. And I stress start date of retraining because it's not a 6 week mark. It's not a 12 week mark. It's not the end of fourth trimester. It is literally whenever you feel you're ready and you have done the appropriate core rehabilitation and core training to build you up for going into that sort of movement. And if it's not appropriate for functional movement, then it's not appropriate core rehab. That's a very strong statement for me to make, but a lot of core rehab and core strength focuses on mat work. And mat work is really, really good. And I do a lot of it with females, but it has to be gauging you for movements that you will essentially do during your life. It has to be movements that target the side and the obliques. It has to be movements that will target single leg, that will target core strength, but also your glute strength. It has to be dynamic based movements, not holding planks and direct core work. And direct core work, I say, is things that are putting pressure on your body in a downward facing motion, at a full downward motion. So you're doing planks, you're doing renegade rows, you're doing things that just aren't appropriate, like in no way, shape, or form, even from your knees. I don't care. You have to start slow. And females will progress at different levels. And that's also an important thing to mention. I've had women that after 3 weeks will return to basic strength function exercises. And after 4 to 5 weeks, they're back doing higher impact exercise because they've simply put in the work either during pregnancy and postpartum, or their body is really readily primed. They minimize the stress. They work on their core and pelvic floor at all points during the day that they can. They follow the simple cues, and that's what you're looking at. Um, Again, no running and impact, not the case. You work it up, you start low, you go slow. And exercise is going to be a key in getting you back to full function. And I can't stress that enough. A big focus for females is weight loss postpartum, and that's great. But if you don't focus on the actual core stability and retraining exercises that you need to do, you will lose weight and you will still have lumbar pelvic pain. You will still not feel your best. Your core won't just automatically come back together. You have to work on it. I am very excited for the next episode because it's focusing more on C-section body image, and anxiety around the C-section scar and pouch. So I'm going to be diving a little bit more into that to give you more research and evidence on it. I also am going to include in the caption for this podcast a review that was recently done on core stability training. It's a 2025 review, very new evidence out, but the evidence on core stability improving the lumbar and the pelvic region, both strength, composition, and function wise going forward. It was covering 10 different randomized control trials. Very, very good, high quality research. Really glad they did it. And it shared that that is huge in minimizing pain and improving muscular strength in your trunk. Ladies, hope you enjoyed today's episode. Hope you got a lot from it. And if you have any questions on what I've shared today, please, please do drop me a message. And don't forget to hit the subscribe button.